5 appropriate communication skills for interpreting would be 1. Listen carefully. If you listen carefully to the doctor, then you'll be able to interpret correctly to the patient, or vice versa. 2 would be to remember the 3 Lee brothers, which are to speak slowly, loudly, and clearly. If you do this, then it'll be easier for both parties to understand you. 3. Be brief and direct. Once you're interpreting, just interpret what is being told or said, because if you add on to whatever is being said, then it would not be the patient or the doctor's word, it would be your word. 4. Use verbal communication, as in speaking in clear or fluent English and fluent Hmong. For example, if you are an interpreter and you cannot speak fluent in either language or one or the other, then it will be really hard for the other party to understand you. 5. Use body language. Using body language would be to have good eye contact with the person that you are talking to. Also, put on a smile on your face no matter what the situation is or how angry you are, thus letting the other people know that you are a professional. 5 inappropriate communication skills would be 1. To talk too fast. If you're talking too fast, then the other party will not understand you. 2. Do not have direct eye contact with elderly Hmong patients, because it is disrespectful to look them straight in the eye when you are talking. Therefore, when you are interpreting for them, look at them but just not directly in the eye. 3. Talking very loud, as in shouting. If you're doing so, then both parties will view you as not professional. 4. Talking too soft or too quiet will also trigger both parties to think that you are not confident enough to interpret, or you are uncomfortable. Also, along with that, they will not understand or hear you as well. 5. Not asking questions when you don't know something. For example, if you do this, then you will not only make the patient misunderstand, but also misinterpret many things that may be important to the session. 5 assertiveness skills would be 1. Be confident. Make sure you know your facts and details of the situation. 2. Be ready. Prepare responses to questions that will be asked. 3. Prepare and ask good questions. Make sure that you ask good questions to the doctor just in case the patient is not clear on what the situation is. 4. Practice makes perfect, meaning that you should practice what you are going to say or ask just in case you get nervous. 5. Have faith in yourself, and also try to be understanding of the aggressive behavior and try to comfort the patient if necessary. 5 inappropriate assertiveness would be 1. To be shy, 2. Fearful, 3. Afraid, 4. Timid, and 5. Nervous. Having one of these would make it hard or difficult for you to get the job done as an interpreter, because if you are too shy, then you won't be able to face the doctor nor the patient. Being fearful of interpreting will make it hard for you to interpret. Being afraid, timid, and nervous will make the job even harder for you. 5 professional conduct would be 1. Involve patient and provider in the pre-session interview no matter how short, meaning that you will have to introduce yourself to both parties and let them know or be aware of who you are and what you are doing. 2. Keeping all information that were discussed within the session confidential. For example, do not discuss service activities to outsiders. 3. Stay calm. If you are able to stay calm throughout the whole session, then that means that you are able to control yourself and be professional in front of others. 4. Treat both parties with professional courtesy. If you do so, then most likely they will treat you professional as well. 5. Being able to separate your emotion from the patient. If you're able to do this, the interpreting will be a lot easier for you to handle. 5. Inappropriate professional conduct would be 1. Giving out your number and personal information to the patient, because that would put you at risk or in danger of many things that could come up. 2. Not appropriately or professionally dressed. If you show up in a tight miniskirt, then of course the doctor and the patient would think otherwise about you and not see you as a professional. 3. Not informing the provider that you're feeling too close or uncomfortable to the session or the case, because if you do not let them know that you are uncomfortable, then you are putting your own mental health at risk. 4. Do not include your own political, cultural, and religious application when you are interpreting, because this is not about you. This is about the patient and the doctor. 5. Do not be subjected to cultural stereotypes. You shouldn't be stereotypical toward the patient or the doctor because your role as an interpreter is to be neutral. 10 key words in English translated into Hmong for this session would be 1. Behavior or conduct. 2. Prepare. 3. Listen. 4. Speak. 5. Loudly. 6. Clearly. 7. Practice. 8. Communication. 9. Questions. 10. Sympathy.